Join us all this week for Maximize Living with Dr. Patrick Andersen. I'm super excited. I'm coming back to Maximize Living. I'm going to check out my x-rays, see what Dr. Pat thinks, and I'm probably going to get some exercises to take home because that's part of everything that they do here at Maximize Living. You're not going to want to miss it. Keep watching Wisconsin's 57 television. Welcome back to Maximize Living. I'm here now with Dr. Pat. We're going to go over my x-rays coming up here.
Yes, we are, and I'm going to tell you about what we found on your exam and give you the best recommendation. First of all, welcome back. How did you do with your first adjustment?
It was wonderful. I felt just like I was standing taller, like my shoulders were, down lower. I didn't feel as scrunched up in my neck.
Awesome.
Just generally kind of felt almost like a buzz afterwards.
Yeah. Some people describe euphoric.
Yeah.
It doesn't necessarily last a long time because your body's really used to that, so
Right.
that's why adjustments are done more frequently for a while.
Sure.
So before we go into what we found on your exam and x-rays, I want to go through some important health principles for you.
Okay.
And you don't have this problem in your spine because of lack of medication, for example. It's really more of a structural problem.
Yeah.
And so we found specific misalignments.
Okay.
So I want to go through what a normal spine is for you. The spine should be completely straight from the front.
Yeah.
And that's what we look at on the x-rays. But from the side, what do you think, straight or curved?
Curved.
Yeah, there needs to be an arc in the low back and an arc in the neck.
Okay.
This actually makes the spine some 26 times stronger.
Wow.
And we even call this the engine, the spinal engine, because so much athletic power comes from having that arch there. Otherwise, without it, there's so many people have a slumped posture.
Yeah.
Forward head posture, they lose their power and they wear their spine much harder.
Okay.
And wears down, it degenerates from that. So we need a good curve in the neck and back. And when life's forces, sitting, strains, old accidents, they cause shifts in our spine, and we call those subluxations.
Okay.
And so that's a pinching of the nerve, and that interferes with the organs. It can build problems. It'll load the joint wrong, cause excessive wear and tear, can cause pain. But many of them aren't felt at all.
Okay.
So that's why when we check you, it's so important to look at all the areas, not just the ones that hurt.
Oh, that's a good point.
Yeah. And so that spinal alignment is critically important. Then one of the things we also look at to see if there's any degeneration going on, we refer to this as our sushi tray. And this is a normal healthy disc.
Okay.
One of the first things that happen is that disc can degenerate as the spine's not working right, as it's subluxated. And then over time, more disc degeneration, and then this lipping and spurring can develop. And then in phase 3, it's much worse than that.
Not good, especially when you look at it from beginning to end.
Yeah. And we do have a lot of control over that by how we take care of our spine, doing our daily exercises and keeping good alignment.
Right.
But here's a big point. Do you think you go through this faster, the same, or slower when you're subluxated?
Now, subluxated is when things are not aligned correctly.
Right.
I bet you go faster.
Much faster. And that's really the key, is to get that balance back so you don't wear your spine.
Right.
Not just be out of pain, but don't wear your spine quickly. Now,
That's important.
the next step, I'd like you to step right over here.
Okay.
All right, Ellen, come on right over here. I'd like to show you what normal x-rays look like.
Okay.
So we're looking for a good curve in the neck. It's actually published to be a 43-degree arc. That's the best arc. We're looking for no forward head posture. We're looking for nice square vertebra, not flattened, with no lipping or spurring, and thick discs. Look how thick those actually are to be healthy.
Yeah.
The same is true of the side view of the low back. You need a good arch.
Okay.
And then the front view here, we're looking for that spine to be completely straight.
Gotcha.
That's optimum structure that drives optimum function, which drives optimal health. You just can't be healthy when your spine is subluxated or off alignment with all those problems that ensue.
Gotcha.
And then the next point is probably one of the most important charts I can share with you, Ellen.
Sure.
There's two kinds of care. We call this the road to recovery. One kind of care is called pain care.
Up and
this
down.
is where you come in, get a few visits, feel good, you wait till you're hurt, and then you come in, feel good again. I'll call you when I need you, doc. and it goes up and down like this. The problem with that is you keep getting these relapses, and to me these relapses are kind of like mini concussions. You just can't keep hurting your spine or having trouble or having inflammation without it adding up to too many problems. A much better way is to do what we call corrective care and then wellness care. So when someone feels better, we're going to say, great, I'm glad you feel better. Let's make sure you have good posture, full range of motion, even leg length, good strength, good x-rays, and get that to stabilize and then be in what we call wellness care. This person is their healthiest. They're not easy to hurt. They sleep the best. They focus the best. Best sports performance.
Gotcha.
Best immune function. Whereas this person is a hiccup away from having something happen all the time.
Right. And so we all want to be there up top.
Right. But we kind of aren't trained to think that way. It's new movement, the wellness movement.
Right. Right.
As opposed to pain care, which just doesn't lead to anywhere but long-term problems.
Absolutely. Very cool. Well, are we going to check out my x-rays next?
Absolutely.
I'm really excited to take a look. You're not going to want to miss it. Please stay with us. Welcome back to Maximize Living. I'm really excited to take a peek at my x-rays. Is that what you have pulled up here?
Yes, I did. Let me show you what we found.
Wow, it's a view that, you never get to see yourself that way typically.
No, and these are very detailed measurements here.
Yeah.
So do you notice anything as you look at that?
I mean, I think to me, without any training, I don't really see anything.
All right.
All of it's kind of alarming because you never get to see your bones.
It is your name right up here, so we know exactly. One of the concerns we have is the forward head posture. You were 38 millimeters forward, and that puts pressure on your neck.
Okay.
And then in the side view here, you've got a curve in your lower neck, or in your upper neck, but then it reverses down here, so it's actually 20 degrees with a -8.
Sure.
And we call that an S curve. So that's hard on the joints over time. Over 10 years from now, you could start showing wear and tear on those discs. So we want to improve that mechanics. Then we look at this view here. This is This is your left side. It's like you're looking at yourself from behind.
Okay.
And we can see the shift off to the right here and then back to the left. And here's where you're getting some of the mid-back pain, some of those rotations in there.
Right.
Now, when we look at the side view of your lower back, what we see there, we have a good arch. In fact, we have a little bit too much of an arch.
Oh,
so this is where like doing abdominal exercises will help you.
Sure.
And then the sacrum, normally that sacrum should slant at 36 degrees. You're at 50 degrees. So that's one of the reasons why your spine was tender when I put pressure right here.
Gotcha.
When I put deep pressure there, I was tender. Because that's kind of an excessive arch, and that can jam the lower back over time.
Okay. Interesting.
All right? And then looking at the view here again, like you're looking at yourself from behind, we could see a low sacrum here.
Okay.
And your pelvis actually measured 148 millimeters left, 138 here. So there's a 10 millimeter twist of your pelvis like this.
Gotcha.
And then we see the curve going back to the left here. So we have exercises to do to help that and home care things that we'll do. But this combined with what we saw on your exam with the weak shoulder, the high shoulder on the left, the plus 10 pounds on weight bearing on the left. The neck was tight on side bending, a little tight on turning to the left. So we had a number of different findings on there, and your spine was tender.
Right.
So based on all of that, it's going to take some time to correct this.
Yeah.
So the best course of care for you to see more frequently at first, because this wants to slip back to its old bad habits after a day or two after your adjustment. So it's best to see you probably 3 times a week would be my best recommendation.
Okay.
And we do that for about 6 weeks.
Sure.
And then we reduce down, most likely if the exam looks good, we'll be able to reduce down to twice a week for about 6 weeks. Past that, you should never need that much care.
Right.
Barring some kind of an accident, we would recommend that you go into what we call wellness care.
Sure.
And that might be once a week for life, it might be every other week for life, or once a month for life, because gravity never quits working on us. So we want to maintain and stay in wellness.
Perfect.
So what I'd like to do now is take you into our office to see Norma, our office manager, and she'll set up your schedule and finances for you.
Perfect. Let's do it.
Norma, this is Ellen. Ellen's had her first adjustment or two, and she's done very well with it. I'm happy with what I'm seeing already. And I have recommended 3 times a week for 6 weeks, and then twice a week for 6 weeks with re-exam every 12 visits.
Perfect.
So if you would go through setting up her finances and scheduling, I would appreciate that.
Awesome.
All right.
Thank you,
Ellen,
Dr. Pat.
welcome to the practice.
I appreciate it. Thank you. Welcome back to Maximize Living. I'm really excited. I just got all set up with a plan, and you're going to show me some exercises that I'll be doing now when I come in to see you.
Exactly.
Okay.
Things you can do at home that are 30 to 40% of your spinal correction.
Wow, that's quite a bit of the process.
It really is.
So you got to do your homework.
So this is called the cervical wall traction. So I'd like you to step right in here.
Okay.
This goes under your base of your head, and this goes under your chin. Now I set that height just about right here. Should do it right about there. We want you to reach up just a little bit with your chin. Take an underhand grip. No tension anywhere.
Right.
I'll tighten that a little bit more. A little bit of a stretch. And then all you do is relax everything and bend your knees so you get about 10 to 20 pounds of pressure. And that's going to help pull that curve into the lower neck where we said it was reversed.
Just like that?
Yes. And you'll feel it lifting on your neck. It helps.
Feels nice.
It also helps with the forward head posture. We'll just do about 10 of those, but we'll work your way up to 20, 30, even 40 of those.
Wow.
So we use this as a warm-up procedure before each of your adjustments. But we also have one of these in a home care kit
Okay.
that you can take home and use over a door.
Perfect.
All right, good. And now we'll just lift your chin and take that off.
Okay.
How did that feel?
Good.
Yeah.
It was easier than I thought.
Yeah, exactly. And now I want to take you down here. I'm going to show you other exercises that will be
Okay,
great for you.
perfect.
All right, Ellen, if you would have a seat on this
Sure.
fancy sit disc here. These help do exercises we like to use both as warm-ups before the chiropractic adjustment so you get a better adjustment.
Yeah.
It also really helps to warm your spine up at home.
Okay.
And keep the disc healthy with good circulation.
Sure.
And so the first exercise we do is pull that disc forward just a little bit.
Okay.
And it's an arch and sway. So we want you to rock your pelvis back and slump fully, and then rock your pelvis forward and arch forward.
Oh, that feels nice.
And then the key is we do that as fast as you comfortably can, going through that full range of motion. So we do 20 count.
Okay.
1, 2, 3, 4, 5. Excellent.
Perfect.
Next one, to get some lateral movement. It's really important because we don't move very well laterally. The ribs
Yeah.
hold us tight, our neck doesn't move that far. So it's really helpful to get that lateral bend in the spine to get the circulation going and hydrate the discs.
Sure.
And so that one, you tip your hips to one side and you tip your head to the same side as the
Oh, that
hip
feels
is high on.
nice.
And then you reverse that to the other side. And so again, we will end up getting coordinated with it and go as fast as you comfortably can. And it's almost like a floppy fish.
Yeah.
And again, the more movement, the better. Obviously, if anything hurts, you can do a shorter motion.
Right.
You know, it's just the idea is just to warm it up. And as you get warmed up, you'll be able to go a little further too.
Perfect.
The next one is rotation, where we sit up with a nice arch in the back.
Okay.
Arms up here for a little leverage. And we rotate left and right in a free-flowing movement. Again, a count of 20. 1, 2, 3, 4, 5, just like that. And you do
Perfect.
you're doing those perfectly.
Okay.
So twice a day, do those at home. And
Sure.
then when you come in for your adjustment, do your wall traction and then your sit disc exercises. And then
Perfect.
take the next available table.
Wonderful.
All right. What I'd like to do now is continue with showing you the things for your home care kit.
Okay.
All right, so the next thing I want to show you, this is your wall traction unit. And this actually will fit over a door like that.
Wow.
And you just shorten this length as to what you need. You just tie it at the right level.
Okay.
And this little block keeps it away from the door so it's more vertical
Oh,
traction.
awesome.
So it should feel just like it does in here.
Perfect.
And this is your sit disc. We've inflated that to the right level for you.
Awesome.
It's also good to sit in at work.
That's
Because
what I
while
was
you're
thinking.
sitting, you're going to never really sit still. It's always kind of shifting on you. So that's good so your back doesn't get stagnant.
Is that good for your core too?
Yeah,
Perfect. Double whammy.
yeah, exactly. And then next is our head weighting.
Okay.
Now, this is a fun thing. There's actually a pound of weight in here. All right, I'll ask you to stand up for me there.
Okay.
And I will put this head harness on. It's actually weighted in the front. That fits down low like that.
Okay.
And right about the level of your brow. And what you do then is it's gonna cause you to pull your head back and actually
tell.
train that forward head posture back. So it's one of the new developments in chiropractic.
Wow.
And we can do lots of things with how we weight the body to change curves.
Almost like weightlifting for your head.
Yeah. Weightlifting for your
Strengthening
head.
the
Very
neck.
good.
Perfect. And we're going to learn some more when we come back.
Yep.
Perfect. Stay with us. Welcome back to Maximize Living. Dr. Pat, you've got a couple more things for me to take home?
Yes, we sure do.
Okay.
And some isometric exercises.
Sure.
The next thing we do is use spinal molding. It's one of the great ways of helping your back.
Okay.
And so this one goes under the neck to help that reverse curve.
Yes.
This one goes under the lower back.
Okay.
Now, because you had too much of an arch in your back, remember on those x-rays you said how steep that was? You can actually put this under your sacrum.
Okay.
And it'll help reduce that arch.
So that's actually going to help my pelvis tilt more forward versus being less curved.
It's going to flatten it more.
Okay.
So this was if your feet were right here, this would go right under your hips like this, and it's going to take that sacrum and stop that excessive arch.
Awesome.
So when you lie like that start with 3-4 minutes, and then go work your way up to 20.
Okay.
These can be used then for longer periods at night in bed. I'd recommend setting an alarm.
Sure.
You know, so you don't go too long. Set it for 20 minutes, and then see if you can add a little bit longer. Some people go all night, but then that's fine.
Right.
The big thing is don't sleep with 2 pillows and have your head pushed forward, because you already have that issue.
Right. Right.
Next, I want to show you an isometric exercise that will be really good for your neck.
Okay.
So you put the hands behind the crown of your head,
okay,
a little bit higher in your head, elbows close together, and you stretch your chin and elbows to the ceiling. And you hold that for 5 to 10 seconds. And you'll feel that stretching all the way down your back.
That feels nice.
You did that really well. And you do that 5 to 10 reps twice a day.
Okay.
For a 5 to 10 second hold. So start at 5s, work your way up to 10s.
Perfect.
This is going to counteract that slump of sitting at work. It should feel wonderful to do.
Yeah, it definitely does.
The next one is because there was a curve in your spine going this direction in the lumbodorsal spine. I want you to do an isometric exercise where you raise your left leg up in the air,
okay,
and out 6 inches, and then put your hand on the side, about right here.
Okay.
And while you hold it there, don't let it move, you push down. You're pushing down and in like that.
Gotcha.
5 to 10 seconds, 5 to 10 reps.
Oh, that's a good one.
And that's going to help take that 5-degree curve and help pull that out of there by activating the psoas muscle.
Perfect.
All right. The next thing we want to do is show you these exercises.
Okay.
These I love first thing in the morning. You know, get up, use the restroom, lay on the floor and do these. These are wonderful. Particularly the one for you is the crunchy sit-up movement here.
Yeah.
Because that's going to strengthen the abdominal muscle to help that excess arch. As you shorten this distance here, it'll lift the pubic bone and reduce that increased arc in your back by doing abdominal work.
Perfect.
Abdominal work is great for your back.
Absolutely. It all works together.
Yes. And then lastly, I want to show you your important information to read.
Awesome.
This is cruise ship or nursing home. We improve our health or lose our health on a daily basis. We're either increasing or decreasing by our daily choices. Great stories in here of people who really changed their life. So I really like you to read that. Next one is, I think, is one of the best nutrition books out there. It's going to talk about anti-inflammation, and omega-3s, and vitamin D, and some great recipes in here that taste awesome.
Ooh, recipes too.
Yeah.
I love that because it takes the guesswork out for you, because most of us, I think, do know good food from bad food, but sometimes we don't know how to put it all together.
Exactly. And this is fun too. This is the Max T3 video, and there's 12 12-minute workouts.
Oh, perfect.
And so this gets you in shape, and as you get, the better you get in shape, muscle-wise, you're actually going to hold your adjustments better.
Wonderful.
And it's better for all aspects of your body. Your brain even connects better and works better.
Awesome.
After you do that. So we'll put all these things in your take-home kit with you.
Perfect.
And you are all set for today.
Oh, wonderful. Thank you so much, Dr.
You're welcome.
Pat. And we'll be back with more Maximize Living after this. Thank you so much for joining us today for Maximize Living with Dr. Patrick Andersen. I was so excited to have my first adjustment, and I came back again, checked out my x-rays, and I've got some homework to do. So we'll catch you next time right here on Wisconsin's 57 Television.